Good afternoon, ladies and gentlemen. My name is Sylvester Gumbo. I'm here again to give you more insight about stroke symptoms and its effects. Today, I'm going to discuss in details. This is an overview. Stroke has a damage to the brain from interruption of its blood supply. A stroke is a medical emergency. We should all know that stroke is a medical emergency. The symptoms of stroke include trouble waking up, speaking, and understanding, as well as paralysis or numbness of face, arm, and leg. So we should have these ones in mind. Early treatment with medication like TPA, that clot buster, that medicine that helps to remove the clotting, can minimize brain damage. Other treatments will be focused on limiting complications and prevention, to prevent additional strokes. So, first, what causes stroke is high blood pressure. Your doctor may call it hypertension. Once you have high blood pressure, you are turning towards stroke. And what are the causes of stroke? Heart disease. Once again, heart disease. This condition includes defective heart valves as well as atrial fibrillation or irregular heartbeat. You be having some irregular heartbeat, which causes a quarter of all strokes among the very elderly. Another cause of stroke is tobacco. And we have been advising people to stop smoking. Smoking and chewing is part of those things that causes stroke. Smoking raises your odds of stroke. There are a lot of embedded risk factors. One of the main reasons, one of the high causes of stroke, which is high blood pressure. There are a lot of risk factors of high blood pressure. I just mentioned smoking. It is one of it. Great risk factor in having stroke. Increasing your high blood pressure, smoking. Being overweight or obese is one of those risk factors of having stroke. Lack of physical exercise, physical activity. You are not working out, you are not going to any place, you sit down from your office, to your car, and from your car to your house. You need to put exercise on a daily basis. Too much salt in your diet is a great risk factor for high blood pressure, which will result to stroke. So reduce your salt intake. You know that salt contains sodium, and these are factors that increases the blood pressure. And if you take too much alcohol as well, it's one of the risk factors. So we must learn to abide by these things, follow it, religiously. Now, if you want to have a bigger look at the risk factors and causes of stroke, 1, sugar intake. You have to reduce your sugar intake. The sugar in the blood reduces the efficiency of you controlling your blood pressure. This is a bigger look of how this blood pressure increases and how it leads to stroke. Another thing is inadequate sleep. If you don't sleep the recommended time, you are expected to sleep minimum of 8 hours every day. And if you are not making up with this, if you are not sleeping up this hour, you are bound to have stress in your system. I have mentioned alcohol. Too much of alcohol leads to high blood pressure, which results to stroke. Now, we know that in Africa, the elderly are cared for. We have relatives who care for us. But situations where they are not cared for, loneliness can result to high blood pressure. And that high blood pressure will lead to stroke. Loneliness, it may not be only to the elderly. It may be to married couples that the husband has neglected. That loneliness can result to high blood pressure, which leads to stroke. Now, again, another thing is increasing the potassium in your meal. Lack of potassium may not be necessarily taking the concentrated potassium in drugs and tablets, but the food you eat, make sure that the food you eat, some fruits are naturally laden with potassium, and you need to take these fruits. One of it is date. Another is your watermelon. Lack of potassium leads to high blood pressure because sodium will take place when you're taking much salt, and that will result to stroke. If you have thyroid problem, one of those things, a lot of people have thyroid. Thyroid or thyroidism is a lack of those things that will protect you, reducing your sugar level in your system. If it is not there, that the bile is not being produced as the way it should, you will have thyroid problem. And that thyroid problem will result to many things in your system. It will affect your liver, it will affect your digestion system, and it will result to high blood pressure, and stroke will result. So, inflammatory drugs also, like ibuprofen, reduce your intake of ibuprofen. These are anti-inflammatory drugs that can increase your blood pressure. We're not saying that ibuprofen is bad. Medically, ibuprofen is meant for a purpose, but we must not abuse the purpose for which it is meant. It's one of those steroids, non-steroid anti-inflammatory drugs. Again, I'm expanding these situations for you to understand that a lot of things that will cause you high blood pressure and result to stroke. Another thing is holding your urine for a very long time. Holding your urine for a very long time results to your sac being infested, your urinary sac being infested. Once it is infested, you have a problem. And we are talking of a lot of problems from elderlies today because of their urinary tract. Again, you need to drink enough water daily. We have the recommendations. Drink at least 8 liters of water daily. That will help you. Drink it. It will aerate your system. It will help to aerate your system. Now, if this is result, there are levels of it. We have various levels of stroke. If you had one stroke before, it is not a guarantee that you may not have another. Take note of this. If you have a stroke before, it is not a guarantee that you may not have another. If you don't take the right medications, if you don't take the right thing concerning your health. If you had a stroke before, there's every 25 to 35% chance of having a second one. So you need to adhere to this medical and experience, that we are giving out to you now. So I'm telling you, likely, there are 3 categories. You have the mild stroke, you have the moderate stroke, and you have the severe stroke. Let us not go into details. The word alone defines what severe stroke is. Patients with severe stroke are unconscious at onset from severe unilateral and bilateral paralysis. Patients may be considered more severe if there's serious medical comorbidity, which adds to the overall stroke disability. And rehabilitation is always very difficult in this case. Severe stroke is what keeps people down, that your leg, your hand cannot move. You remember when we're talking about stroke, we talk about mobility of your hands, numbness. This one, the numbness is serious. It affects your brain, it affects every part of your system. How do we take care of these things? First, we have to consider our blood pressure. How to take care of our blood pressure. If you are following my videos, you will see that I mentioned Zobo, local things that help you to reduce your blood pressure. I showed instances of how you can take Zobo and how Zobo can reduce your pressure from even 135 to 115, 117. High blood pressure is a killer. You know, our medical people call it hypertension. It's a top cause for both types of stroke, all types of stroke. So it is a good, but you will need medication to bring your readings down. And common treatments work in different ways. And the ways that I have just mentioned, like taking Zobo traditionally, can help you bring your blood pressure. I'm not saying that the other medical means does not make it work. It makes it work very well as well. But every conventional drug has its side effects. But what I'm recommending to you today does not have any side effects. There are a lot of details about high blood pressure, how potassium in your system can help you, sodium can increase it, and these drugs, they work in different ways. So I beg you to look at it. Now, I am speaking much. I say, what are the local medication? What are the herbal medicines for high blood pressure? You know, I have mentioned Zobo, for instance. Another one local that can help you to reduce your blood pressure is garlic, thyme, cinnamon, ginger, and cardamom, to name just a very few. Basil is one of it. Chinese cascue for those who are overseas. But in our local balance here, we have them common. We have garlic common, we have thyme common, we have cinnamon common, we have ginger common, we have cardamom common that we can use. Now, I bet you preparing this local medication is as simple as anything. You can blend your garlic and thyme with ginger. Blend it and use it in your soup. Reduce the usage of processed seasonings. Reduce the usage of processed seasonings. They contain a lot of sodium, and that can increase your blood pressure. If you have all this in place, I bet you your blood pressure will go down. And again, coming to the effects of stroke. The effects of stroke, one of it is muscular. Difficulty walking. You see a lot of people who are in the severe stroke stage. They find it difficult to walk. You see that their one hand and one leg is paralyzed, or both legs are paralyzed. Right from their waist down is paralyzed. Their hands are paralyzed. Those are severe cases. So difficulty to walk, paralysis with weak muscles, problems with coordination. You know, their brain coordination is a problem. Stiff muscles. Some you have their hands that are stiff. This hand cannot be as flexible as it is. See, I am telling you based on experience. I am a stroke survivor. And I'm telling you how you can go ahead and come out of this situation. Overreacting reflexes is one of those things that people who suffer from stroke experiences. Paralysis of one side of the body. The side of the body could be paralyzed, your hand and your leg. Your mouth. You see the mouth will bend to one side. Those are the effects of stroke. Visually, Stroke also affects. It will cause a blurred vision. You will not be able to see clearly, or you will be seeing double. When you want to see, you see double. And sometimes sudden visual loss or temporary loss of vision in one eye. You see temporarily your eyes, you are not seeing in one eyes. Those are the effects. Remember, I am talking about the effects. What people experience, those who have experienced a stroke, what they experience, muscular problem and visual problem. Now I come to speech. They have it difficult in speaking. Difficulty in speaking. It's so difficult for them to speak when they are speaking because it affected the glands and the organs in their system. The tongue is responsible for ensuring clear sound. If the tongue is affected, you hear them speak, that is the problem. It affects speech, difficulty in speaking, slurred speech, or speech loss. Some cannot even talk. They'll be looking at you when you are talking, they'll be looking at you. Speech loss. And sometimes it affects the whole body. They will be fatigued and weak. They are light-headedness. If you sit up from one place, they feel like they are going to fall. If you rise up from the seat, they are falling. So somebody will be holding them. They need assistance from one place to the other. Numbness. Their limbs will be numbed and weak. And one of the reasons the muscular issue is there, that they cannot move. Sensory. They don't feel pains. Remember, I'm talking about the effects of stroke in the system. They cannot feel pains. If you pains and needles cannot even, excite, sensation in their system. So they have a reduced sensation. As I mentioned earlier, facial, the muscle weakness and numbness. The facial look will be bent to one side because the muscles are not working bilaterally. So you see the facial nerves will be shifted to one side. There is a common problem in all. Remember all the stages that I mentioned earlier, severe, mild, they have one common problem. Balance disorder, difficulty swallowing, headache, inability to understand, mental confusion, and nystagmus. Well, I have spoken much, and I've told you about the medications that is needed, local medications. But if you want to go foreign, there are some medications that you can also take, like the tissue plasminogen. They call it an activator, TPA, tissue plasminogen activator. It improves the chances of recovering from a stroke. But outside this, if you have problem with walking, you have problem with your system, you have problem with balance, you have problem with, there are a lot of medications that I will be bringing out on this, my page, for you to see. Mango leaves is one of them. Moringa, there's a way you prepare it that you can even get immediate. Even the yam leaves, they are such that you can easily do, and it will help you to regain yourself. So these are the ways I think you have to abide to help you reduce your problem with stroke. Thank you. Like my page. Follow me on my Instagram. Follow me on my WhatsApp. Follow me on Facebook and YouTube. My name is Sylvester Gumbo, and you'll be able to get a lot from me. Many are coming. Thank you for listening. Like my page, the notification button on my YouTube, click on it. You will get more from it. Thank you, and God bless you.